Hi, everyone. I'm Jay Watson with Emory Brain Health Center, and I'm joined today by Dr. Marybeth Sexton, Assistant Professor of Medicine and Infectious Disease Expert at Emory University School of Medicine. Dr. Sexton, thank you so much for joining us today.
Thanks a lot. Hi, everybody.
So yeah, we always have a bunch of questions come in beforehand when we let people know the Facebook Live is coming up. So we'll start with those, and then we'll move to the other questions that come in. But the way I'd like to start today, if it's okay with you, is to ask you to paint a picture for us of how Georgia is doing this week. I read this morning that the last 2 days were record high death days in Georgia. And I guess my leadoff question with that is that a blip? Is that a trend, an anomaly? So if you could, the overall picture of Georgia.
So I think, unfortunately, that increase in deaths is not unexpected, because what we've been seeing since late June, early July was a second surge of cases in the state. And those numbers over the last 7 to 14 days of a rolling average look like we have largely plateaued. We still have one of the highest case rates in the country, but it doesn't appear to be changing significantly. What we know is that it takes a while from somebody initially getting COVID to having symptoms, to being sick enough to go in the hospital, and then to having a hospital course where they unfortunately don't do well and may die as a result. But that can take a couple of weeks. Mm-hmm. And so you do expect to see this trend where the cases go up, then the hospitalizations go up, and then the deaths go up. And that's unfortunately how we would expect this to progress when we've got case numbers that look like ours do.
Okay. So we're going to move on to some of the questions. We're going to pop back and forth. There are a lot of school questions in here, school and college questions, college football questions, and actual virus questions. So we'll begin with certain school districts in Metro Atlanta are constantly on national news after not requiring masks and then having to shut down because of cases. Is there any way kids can go to school and be safe and not wear masks?
So I think there is no way to do it safely without masking. And that's unfortunate, because I know no one, even infectious disease doctors, likes walking around in a mask all the time. But it is the single most important thing that you can do in the community to prevent the spread of COVID. And what we're learning about how they work is that they do really help to protect the people around you. If you're wearing a well-fitting mask, it serves as a barrier to you putting any of that virus out into the air around you. But we're also learning more that they probably protect you too. And particularly well-made multi-layer cloth masks that people can get very easily now, those are good at both. The main thing they do is keep you from spreading the virus to others, and everybody else wearing a mask does the same for you. But it does look like you probably get some benefit as well. The issue with going back to school at a time like this is that the community spread in most areas of Georgia right now is still high. And so there's been some modeling that says with a 1,000-student high school in Fulton or DeKalb County, you would expect 10 to 15 students on day one to be positive for COVID. And if you expect that everybody with COVID on average infects 2 to 3 other people, you could see how this could very quickly go through a classroom or a school. And if you're not wearing masks, it just drives that spread, because people will be putting those viral particles out into the air in what's probably a pretty small, crowded classroom that's not made for ventilation like a hospital room is.
So districts not requiring masks, how do they get out of the cycle then if they're not going to require masks, where they're constantly shutting down and quarantining because of exposure?
I think that you won't unless you break this cycle in the community. So these things feed each other. So if you've got a lot of spread in the community, you're absolutely going to have people in your school building who have COVID. And then if you concentrate a lot of people in a school building, you may spread COVID further, and people may carry that back to the community. So kids, for example, who may not be at high risk for complications themselves, may bring it home to vulnerable parents or grandparents. And you've got vulnerable adults potentially in the building, from teachers to school bus drivers to the people who work in the front office to the people who work in the cafeteria and to the custodial staff.
Right.
So there's a lot of people at risk there. I think that masks aren't the only important thing. There are other measures that people can take. So things like distancing, which may mean you don't have the whole school in the building at the same time. You may have to have staggered starts. You may have to have some kids there on one day and not another in order to accomplish that. You need to be careful about things like class changes and where kids eat, because everybody has to take their masks off to eat and drink. And so a lot of businesses have seen issues surrounding offices and break rooms for that same reason. So you have to be very careful about the cafeteria. So there are a lot of other things that you can do, but without adding the masks on top of that, it's going to be incredibly challenging to not have spread in a school building.
Next question. Please ask if she would allow her child to move into a dorm in downtown Atlanta right now.
So I think this is a really challenging question, and it involves a lot more than the dorm. So it depends on what the college is doing across the board for safety. So if they are holding in-person classes, how many people are in a classroom? Are they requiring masks? How are they spacing out students? If you're doing things like group work, how is that being handled? How is lab work being handled in the science classes? All of those things where you might have people in close proximity to each other. What are they doing in the dining hall? Do you have 1,000 students converging for dinner all at the same time, or are they just doing takeout and eat back in your room? Are masks required in all public buildings on campus? Is hand washing and distancing emphasized? If those things are all in place, if you have masks in public buildings, if you are practicing distancing in the classroom, then the dorm room itself is probably not your biggest concern. Although you have to realize that sharing that room with another student, it also does depend on that other student's behavior, because that is a small space. You're potentially going to spend a lot of time together. You're likely not going to wear a mask in the dorm room, especially not when you're sleeping. And so if you had a roommate who was not taking those precautions seriously, your risk goes up and vice versa. But that's probably a similar risk to people who live in the same household, where we know that the risk of transmission is probably about 20%. It may be a little higher if you're living in one room together instead of sharing a whole house, but it's not a foregone conclusion. So it's really a matter of what else is going on that campus and not just what's happening in that dorm room.
Got it. What should grandparents do to protect themselves now that their grandchildren are back in daycare?
So I think this is really hard because grandparents, of course, love to see their grandkids. But if you've got grandkids who are going to daycare and who are mixing with other kids, with the employees in the daycare, those kids all have their own exposures at home and in the community. It really increases the risk of your grandkid being infected, and they may be asymptomatic, but that doesn't mean they can't pass it to you. Mm-hmm. And so I think this means that some visits may unfortunately not be safe, and that if you are going to see the grandkids, a couple of things are really important. One is that, first of all, you make sure they don't have symptoms at the time. So you certainly, if they are even the least bit sick, don't want to have a visit. If they feel completely well, then you would need to take precautions. So outside is safer than inside. Distance is better than not. Try not to be in an area where you would be in a really small space eating and drinking. And then the same things of masking, distancing, washing your hands. If the kids are old enough to wear a mask, they should too. Those things all make it safer. Nothing is unfortunately foolproof.
That's good advice. If a child is at college, what precautions should family take when they come home for a weekend?
So I think that this is in that same vein, is that you just have to realize that you're having somebody come back into your house who may have had hundreds, if not thousands, of direct or indirect exposures to other people, depending on what the behavior has been like at college. So it may be that you actually don't do weekend visits during this particular semester. It's one of the reasons that a lot of colleges started a little earlier and are going to finish in-person classes by Thanksgiving, so that you don't have this back and forth where you both introduce things back into the home community and the house, but also may then bring things back to the college campus. So this works both ways from a safety standpoint. It's probably safer not to do it. If you're going to do it, those same things apply. You want to make sure that your college student doesn't have symptoms before they come home, and ideally wouldn't share a bedroom with somebody, would try to distance as much as possible, and all of that emphasis on hand hygiene, and particularly if you're going to have any kind of family gathering, outside and masking are both important.
What do you make of the fact that new cases have plateaued around 3,000 a day? Does that mean that we should start to expect 100 plus deaths a day or even more in the coming weeks?
So I think that with the case numbers that high, we do run that risk of seeing a subsequent increase in hospitalizations and in deaths as a result. I think that the other takeaway, though, from that is that if we have gotten cases to plateau, we should really drive the focus on getting them to go down, because that's what will prevent those hospitalizations and those deaths from increasing daily to follow. And so we should take that as a sign that at least it's not continuing to go up, but that means that something that we did is starting to work. So that's not a sign to back off. That's a sign to go harder on these preventive measures in the community, to not be having big gatherings, to not be out in public when you don't need to be, and to make sure that you've got a mask on.
I would like to understand better how they have determined asymptomatic people have transferred the virus. Is it just based on contact tracing information, or have they done actual studies that show the virus is transmitted this way?
So there's a couple of things that play into that understanding that we know that people spread before they're symptomatic. One is the fact that we have been able in a lot of studies to detect the virus in fairly high quantities in the nose and the back of the throat of people before they have symptoms. And sometimes it's even a higher load of the virus than is there when they do have symptoms. So that's a bad sign for people being contagious when they're not symptomatic. And then the other thing is the contact tracing that you mentioned. If you have, let's say, a couple living in a house where one person in the house is working outside the home and the other person hasn't left the home, and the person who hasn't left the home gets symptoms and tests positive for COVID, and then you test their partner and they are likewise positive, but they've not had any symptoms, you know you had asymptomatic transmission there, because that person who doesn't have symptoms was the one going outside the home, probably brought it in and infected their partner. So we see those direct kind of examples where that's the only way they could have possibly gotten it, is from somebody else who doesn't report any symptoms. And then we also know we can find the virus in the nose and throat of people who don't have symptoms. But I think the other thing to remember is that a lot of what's gotten labeled as asymptomatic spread is actually people being contagious right before they have symptoms, or people being contagious with symptoms that they don't recognize as COVID. And this has been sort of the blessing and the curse of COVID, is that a lot of people who have this don't get very sick.
Right.
The problem is they often feel okay. And so they may not realize they're sick. They may be out in public. They may be in a position to spread the virus. We've had a lot of people tell us, well, I felt really sore and achy, but I thought it was because I went to the gym. Wow. Or, well, I felt really tired, but I didn't have a good night's sleep. Or I felt congested, but I do have allergies. And so it's important to remember those mild symptoms count too.
How safe is it for people with a health risk like obesity to take part-time work at retail stores, especially with Georgia's positive number so high?
So I think that the problem is that we have identified certain health conditions that make you more likely to get sicker if you get COVID. These are the people who are more likely to be in the hospital, to be in the intensive care unit. And some of those conditions are underlying heart or lung disease and underlying obesity. So all of those things do put you at increased risk for complications. But if you need to be out working, there may not be anything you can do about that. And this is why there are people who are essential workers. And so what we have said is that if you're going to go to work and you're in that situation where you know you're at increased risk, try to take all the precautions you can for yourself. And also, if you're in the position of looking for a job, ask them about the precautions they take to protect their staff. So you would want to look for a retail store that requires masks. Because if the people coming in to shop there are wearing a mask and you're wearing a mask, it dramatically cuts your risk of getting COVID. You want to look for stores that have set up social distancing markers in the lines to check out so that people aren't on top of each other and that people don't get right in your face if you're checking them out. You want to have store management that's going to back you up if you ask somebody to take appropriate precautions and they refuse. And you want to make sure that you've got access to a mask and to the ability to either wash your hands or sanitize your hands after any kind of hand-to-hand exchange with a customer.
This is our first question we've gotten on this, and I just heard this term this week, being a long hauler, which my understanding is long haulers are people who have symptoms that continue to persist for weeks and months afterwards. So this question is, need advice for long hauler care. Not sure how to help, but having significant flare-ups with return of symptoms after 4 months. Not sure what doctor or specialist to go to for care or monitoring.
So I think this has been really challenging, and this is one of the things that we'll continue to learn more about as time goes on with COVID, and that is why there are some people who either have a very long course at the beginning, so they have symptoms for 2, 3, 4 weeks when the average person feels better by about 7 to 10 days, and why there are these people who seem to have these periods where they feel a little better and then they feel worse again. They feel a little better and they feel worse again. And what drives that or predicts that, we don't know yet. The good news from the data is that it seems like even in people who are immunocompromised or who have been critically ill with COVID, even if they still test positive, sometimes for weeks to months, when they've done studies, they can't actually isolate virus that is capable of infecting somebody else. So it doesn't seem like people in this situation are still contagious beyond usually 10 days, which is where that criteria comes from CDC, saying you can get back to your normal life if you're feeling better at that point. But even in that small group of people who are contagious longer, they haven't found people beyond about 20 days. So if you are in that situation of being 3 to 4 months out, you should be able to see your doctor for a referral to someone or for them to help you out. They should ask you to wear a mask. They should wear a mask just like they should for everybody. But the likelihood of still being contagious at that point is low. There are hospitals and medical centers that also have dedicated COVID and post-COVID care clinics that are now starting. So something like that might be your best bet, but you should be able to see your regular doctor at that point too.
Is it true that exposure time is really about 15 minutes with an infected person versus just passing by an infected person?
Yes. So what we consider an exposure per the CDC guidance is at least 15 minutes of face-to-face contact with somebody. So something where you're within that 6-foot range. And there are clearly gradations of this. So if you are absolutely right in someone's face, could you get infected in less than 15 minutes? Yes. If you're in the same room with somebody for 20 minutes, but you both have a mask on, are you likely to get infected? No. And that exposure goes up with time. So 15 minutes is better than 30 minutes is better than an hour. But that is about the time that they estimate on average that it takes to get a sufficient exposure. So you should not get infected by passing by somebody in a hallway, for example.
How safe is it to go to a dentist who is following CDC guidelines? I'll add to this, I just read yesterday about the WHO kind of advising people not to go for regular dental checkups right now.
So the issue here is that it's actually the most dangerous for the dentist, because when you're in their chair, you have to take your mask off, and they are usually bending right over you, right over your nose and mouth. So they will be wearing a mask and eye protection to protect themselves, but that's not perfect, and they're in very close proximity and usually for more than 15 minutes. So the real risk is to the person you're seeing for care. So if you go to the dentist, it is critical to make sure you don't have symptoms or a fever when you go, and that you don't have an exposure to COVID recently that you know about. But if your dentist is following all the precautions and you yourself need dental care, that should be fairly safe for you, as long as your dentist is masked at all times.
This next question says, I am old, 82, class of 1960, have no symptoms of suspicious contacts. Is there any reason for me to be tested?
So what we have generally said is that under those circumstances, no. And that's for a couple of reasons. One is that there are unfortunately still some shortages in testing supplies. And also, because we've had so many cases and contacts in the country, there are so many people getting tested but there's been a real backlog in results. So some places are taking 7 to 10 days to turn around a test result. And by that point, if you have COVID and you weren't taking precautions, you could have infected several other people at that point. So that's a little late to act on. So it's really important that people who have symptoms or who are being worked up as part of contact tracing to make sure they don't spread COVID, that they have access to those tests. And so that's who we really recommend testing for, are people who either have symptoms or who have been exposed as part of an investigation. I think ideally we would get to a point where people could be tested before, say, you traveled to see someone else so that you knew at least on that particular day you weren't going to expose them, or before we did certain kinds of jobs, or even in some of these school settings. But we're not there on the supply chain at the moment.
Right.
And especially if you know you haven't had an exposure and you don't have symptoms and you're taking all the appropriate precautions, then there's not much that you have to worry about right at that point. And so it's probably better not to right now.
Once someone has been infected, been through quarantine, recovered, are they safer to be around? Second part of the question, are those not having been infected dangerous to the recovered?
So I think for the first part of the question, somebody who has had COVID and who has passed that 10-day time frame since their symptoms started and they feel back to normal, they are incredibly unlikely to be contagious. We still recommend that they take and that you take all of the same precautions. And this is to the point of the second part of the question, is that it doesn't look like right now that people are getting reinfected in a short time period. People test positive for a long time, but there's not been great evidence of people really within a couple weeks or a couple of months getting sick again with COVID.
Mm-hmm.
Thus far, we haven't seen that, but we don't know enough to know for sure. We don't know that everybody makes antibodies. We don't know how protective the antibodies are, and we don't know how long they last. And so the safest thing is to always follow the same precautions. So, for example, I had COVID in February. I have antibodies. I still always wear a mask in public. I wear a mask and eye protection when I see patients. I wear full gear when I take care of COVID patients because we just don't know.
My job is planning on having us back at the office in September. We will be socially distancing, staggering shifts, etc. But our building has 15 plus floors that include other organizations. How safe is it to ride the elevator?
So I think that the elevator has come up a lot because it's clearly a small enclosed space. So I think that the good news is you're not on it very long and you can take some safety precautions. So, and this could end up being an annoying wait in a building with 15 floors. But if there are already more than 2 to 3 people on a small elevator, try to wait for the next one. Make sure everybody on the elevator has a mask on. If you can't use your elbow or something else to hit the elevator button, then just make sure you wash your hands as soon as you get to your floor.
Can COVID be transmitted through sweat droplets?
Not that anybody has ever seen. Right now, it really seems like this is predominantly respiratory spread. So somebody, when they speak or breathe or cough or talk, sing, puts those droplets out into the air and somebody nearby breathes them in. There's some possibility of contact spread. So you sneeze on the doorknob, I touch the doorknob, I put my hand up to my mouth or my nose. But that seems to be less of a contributor than the true respiratory spread. But we haven't linked other types of body fluid or other types of contact.
My high school is not making mask mandatory, and it's impossible to socially distance. This is a small private school and very small spaces. Should I be worried?
So I think, unfortunately, in that setting, if the masks aren't mandated and you can't distance, it's certainly a higher risk situation. I think that one of the things to try to do in that situation is that just because it's not a requirement doesn't mean that people can't wear masks. And one of the nice things, I used to be a high school teacher, one of the nice things about high school students is that usually they really do want to help each other out and they're interested in keeping their families safe too. And so if it can be put to students that way, that while this may be an annoyance, and a little bit uncomfortable, it's perfectly safe and it helps keep everybody, themselves, their friends, their teachers, their families, their neighbors safe. And to really try to push that point, because the combination of not being able to distance and not having masks on really is a setup in a small space to spread COVID.
I think we have time for about 2 more questions. Can you offer some language or strategy when relatives and friends want you to visit and you know it's not a good idea because they are at risk or because you're from Georgia?
And I think this has been really hard because people want to see each other, people want to see family. There have been disagreements about risk level and how to handle it. But what I would and have said in this situation is, I'm sorry, I really can't right now because I don't want to put you at risk. I'm coming from an area where there's a lot of spread in the community. We know a lot of people have it. There's no way to know because people do spread it without symptoms for sure that I don't have it. And so I don't want to do that to you. And I think that most people can appreciate that.
That's good advice.
Especially when you frame it as being concerned about their safety, even though you should also in that situation be concerned about your safety.
For
that
sure.
will help.
Okay, last question. And this allows you to get up on a soapbox, this question does. It says, if you could wave a magic wand, what would you have people do to handle the high transmission rate in Georgia right now?
So I think that if we all in Georgia right now did a couple of things, that 4 weeks from now our numbers would look very different. And we know that from having watched some other hotspots, New York City being a very big one right at the beginning of this, where they put the brakes on activities very hard and they saw a significant downtrend to the point where they actually meet criteria for it to be safe to reopen schools. And so I think that should be a goal, is to have it be so safe in the community that we don't have these concerns about sending our kids to school. And so what I would have people do is everyone wears a mask in public. People don't go out for a couple weeks to a month except for essential things like groceries and work. People distance. People don't have large gatherings. They don't have family parties, pool parties, those kinds of things for the next couple of weeks. And that we don't do in-person dining at restaurants and bars. I think those are the things. If we stopped in-person restaurant dining, going to bars, large gatherings, and everybody wore a mask and tried to distance and avoid being in public when possible, I think we would do a lot in the next couple of weeks to stop this.
I think that's perfect advice and a perfect way to end our Facebook Live time with you, Dr. Sexton. I know you're incredibly busy, so thank you for taking the time to be with us today, and we hope that you can join us again sometime.
Thanks a lot.
All right, everyone at home, be safe, be well. We'll see you next week. Bye.